And I'm joined now by Labour's Shadow Health Secretary, John Ashworth. Mr Ashworth, good morning. I should say at this point, the Department of Health have given us a line on this. We're investing more in mental health than ever before, spending at a record £11.6 billion this year. The benefits of record funding can already be seen in areas such as mental health support in A&E, 24/7 crisis services and support for pregnant women and new mothers. Look, the situation in Liverpool is but a snapshot and it's not reflected across the board. But the idea that there would be parity of esteem, an aspiration of parity of esteem between physical and mental well-being, we're some distance from that, aren't we?
Considerable distance, as we've just seen in that very moving package. The problem is that the government, over the first 5 years of their time in office, actually reduced the proportion going on mental health spend. It's why, for example, we've got 4,000 less beds, we've got something like 5,500 less nurses working in mental health. And although the government now says they're increasing the mental health budgets, they're not doing what we call ring-fencing it. They're not saying to local health boards, the CCG, as we call them these days, we're not saying to them, you have to spend this money on mental health. So because of the wider pressures on the NHS, many of these local health areas, the CCGs, are raiding those budgets and transferring the money into the wider running of the NHS because of the overall underfunding of the National Health Service. So we're saying, ring-fence that money, actually put a ring fence around the mental health budget, so rather than it being cut at a local level, as we've just seen in Liverpool, it actually goes to those who need it.
Still, I can't remember a time when the party of opposition didn't say that the NHS was in crisis in some form or another. So what makes the situation affecting the NHS at the moment, in your mind, as acute as it's ever been?
Oh, I think we're in a very serious situation. I mean, new figures that we've seen in the last few days show that the waiting times are now at 4 million and could hit 5 million, according to Simon Stevens, the NHS boss, if they don't get more money. And the number of people who are designated as a trolley wait, that's people who can't even get a bed in an A&E. In the last year, it's been 565,000. Under a Labour government, it was 60,000. That's the scale of a difference. Just today, I've released new figures which show nearly 27,000 people are not getting an urgent referral for cancer treatment within 2 months. And of course, we all saw the very serious winter last year in the NHS with ambulances backed up, people in corridors. It's incredibly serious. And if I may say so, I've seen Philip Hammond doing interviews today. He's been kind of dismissive of the calls for more money for the NHS, saying, well, it's going to be Armageddon. This is happening now, today, in the NHS. And if he doesn't realise that, he's completely out of touch.
But isn't part of the problem that we never seem to be able to have an adult discussion about the funding of the health service or whether it should be providing free treatment in every instance without someone somewhere suggesting that you're proposing privatising the entire thing? I mean, a number of your colleagues have made the point that perhaps now is the point at which we should move the health service and attendant services out of the world of party politics and have some non-partisan approach to it all. What do you make of that?
Well, I'm always happy to talk to anyone about the future of NHS financing. I mean, we in the Labour Party are calling on the Chancellor to put aside an extra £6 billion in this budget coming up. But over the next 5, 10, 15 years, I'm up for a discussion in this country about long-term funding of the NHS. All the think tanks suggest that we need something like an extra 20 billion by 2022, 2023, and so on. So
none of that removes the fact that the health service is a political football that gets punted from one side of the chamber to the other.
Well, I wouldn't say it's a political football, but politicians have to make choices about funding. And this is a government which over 7 years has chosen to underfund the NHS, has chosen to cut the public health budgets, which is the budgets which deliver things like sexual health services support and smoking cessation support and health visitors and things like that in the communities. All those budgets have been cut. And of course, social care budgets have been cut by billions, which is putting huge pressure on the NHS because there's so many elderly and vulnerable people going without the care package. So I don't want to use it as a political football, but I think it's right and proper that we highlight decisions that the government have made, which is having a consequence for patient care today.
Now that we have you in the studio, and we've been looking forward to this, I've lost count over the weeks that I've been doing the show of the number of times that you or your colleagues have said that Labour is a government in waiting. I mean, what does that mean, given that technically every opposition is a government in waiting and some of them wait quite a long time?
Well, I think it actually means that we are preparing to take over when this government falls. I mean, this government is looking increasingly hapless. And we've now got David Davis in the newspapers saying he may well walk out. I mean, Philip Hammond today has also said that there's no unemployed people in this country. I mean, how out of touch is this Chancellor? I mean, Theresa May looks completely bewildered all the time. I mean, this government could collapse at any moment. And we're making the point that we have got a programme for government and we're ready to step in. Given
your contention that this government could collapse at any moment, it is then therefore fair for us to ask for specific answers to specific questions. How much should the UK be giving the European Union as its bill for leaving the...
Well, that's part of the negotiations, isn't it? I mean...
But you've got to have an idea.
Well, that's why you go into a negotiation.
20 billion, 30 billion, 40 billion...
We go into a negotiation, don't we? But clearly we want to have the best access to the single market and the customs union to safeguard British jobs and prosperity and the NHS, because the NHS is impacted by our relationship with the European Union. But these are matters for negotiation.
In terms of the project of nationalisation, which of course is central to Labour's claim to being a government in waiting, rail, electricity, water and Royal Mail, how much would it cost? How much would it be funded?
I mean, John McDonnell has said that these are matters that he will bring forward. He will bring forward these calculations in due course. But what I can tell you, in the NHS, the privatisation in the NHS means that we're now spending $8 billion on the private sector. It is destabilising the NHS. I'll give you a quick example. In Sussex, a contract for patient transport was given to a private company who didn't even own any vehicles, who subcontracted out to 20 other companies, and two of whom went bust, and the workers had to go without wages. Look, so we are saying on things like that, they need to be brought in-house.
Yeah, OK, but on that point, we heard from the Shadow Chancellor this morning. His idea is that you would swap shares in these kind of private, these entities for government bonds. It is, in essence, borrowing by another name. It would almost certainly be in excess of £100 billion. But let's contrast that with your offer on, public sector pay. I mean, what are you proposing in terms of a rise for NHS staff specifically?
Well, we've said we want a real terms rise, but that will be decided through collective bargaining, through the pay review bodies, through a proper process. What we don't think is fair is this pay freeze which has been in place for 7 years. Now, the Chancellor and Jeremy Hunt are saying that we're going to get rid of this pay freeze, but they will pay for it by productivity gains. No, we don't want productivity gains. We want a proper, fully funded pay rise for NHS staff. Productivity
my point
gains.
Is this: you're willing to spend in excess of £100 billion on money we don't have, on stuff that we do not need, but you're not willing to borrow to give a proper pay rise to nurses.
No, because we can fund a pay rise through different decisions on taxation.
Right.
We can make different decisions on corporation tax, on income taxes for the very wealthiest in society, and we've been very upfront about that. The top 5% will pay more tax in this country, but that will allow us to fund public services like schools, like hospitals, and indeed give NHS staff a fair pay rise.
With the announcement on housing, it does appear that the government is parking its tanks very firmly on your lawn, doesn't it?
Well, we'll see. I mean, we've had umpteen announcements from the government, from this Chancellor and the previous Chancellor on housing, and you know what, the houses never seem to get built. So we'll have to look at the detail, but the record so far doesn't leave us with much confidence.
But certainly the one thing the Chancellor doesn't want to do is borrow any more money.
Well, we'll have to wait and see. I mean, we've had Sajid Javid going around saying that he should borrow more money to build houses. So we're going to see who's going to be successful in the budget. Will it be the Chancellor or will it be Sajid Javid? I suspect that the number of houses we need in this country won't actually get built because we have loads of big announcements, we have loads of targets from this Tory government, and yet they never actually follow through.
Whilst we have you, what do you make of the former Scottish Labour leader, Kezia Dugdale's decision to go into the jungle on I'm a Celebrity? I mean, should she be suspended from the party?
Well, I think Jeremy has said she shouldn't be suspended. Or these are
yeah, Richard Leonard said something slightly different.
Well, these are matters for the Scottish Party. I mean, look, I like Kezia. I got on with her well when I don't know her particularly well, but when I did meet her, I got on very well with her. But I think there are better ways to further the cause of the Labour Party than eating kangaroos' whatsits in the jungle.
Conversation I never thought I'd be having on a Sunday morning before I've had my porridge. But I mean, would you ever do it? Would you ever appear on reality TV? I don't know. I perhaps see an appearance on Love Island, maybe? Celebrity Love Island?
You've got to be kidding, haven't you? No, not me, no.
No, but there is a real point here, isn't it? That politicians do sometimes seem a little bit distant from the people that they're supposed to represent. There's nothing wrong with this. It's a bit of fun, isn't it?
Yeah, but I think the difference is Ed Balls, for example, when he went on Strictly and became a huge superstar, everyone loved him, but that was after he was a politician. I think it's difficult when you've got a full-time job as a politician, when you're a parliamentarian. But look, it's a matter for the Scottish Party, and you know, and they'll come to a decision, I'm sure.
We'll wait and see. John Ashworth, many thanks for being with us.